Question number 6. Which of the following muscle is not attached to the proximal phalanx of the thumb? Flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, adductor pollicis. All the muscles named here, they are together called thenar group of muscles. So which of the following muscle does not inserts onto the proximal phalanx of the thumb? It's easy if you think about, if you ever seen the images of attachment of muscles on the skeleton of hand, remember that the AFO together is called the muscles of thenar eminence, and that includes abductor, flexor, opponens, pollicis, brevis. These three are called the muscles of thenar eminence, which form the bulging contour over the first metacarpal, and these three muscles are innervated by the median nerve. However, adductor pollicis is a deeply lying muscle and it is innervated by the deep branch of ulnar nerve. One more important point is that adductor pollicis is the last muscle to be innervated by the deep branch of ulnar nerve. So I've added this image, that's the skeleton of hand, the palmar view, and here all the muscles getting attached, maybe origin or insertion onto the skeleton of hand have been shown. But our purpose of this image is to show you the attachments on the proximal phalange of the thumb that is in question. So why not let's zoom this out for you. I hope it's a bit better now. So as I was talking about the four muscles of thenar group, remember AFO. Now this AFO is actually abductor pollicis brevis. Remember, this is abductor, and it's easy if you remember that the purpose, the action of abductor is to pull the thumb away from the rest of the digits. Remember, abduction of the thumb is not laterally, it is anteriorly, right? Because it's at 90 degree to the plane of the rest of the digits. So abductor pollicis will be inserted onto the lateral aspect of the proximal phalange. And flexor pollicis brevis. These two muscles together, they are attached onto the lateral aspect of the base of the proximal phalange of the thumb. While on the medial aspect of the base of the proximal phalange, there is attachment of adductor pollicis, right? Don't confuse with abductor and adductor. Adductor will obviously be attached onto the medial side because it has to adduct the thumb. So adductor pollicis along with the first palmar interossei, both these muscles will be attached onto the medial aspect of the proximal phalange of the thumb, right? So two muscles on the lateral side, abductor and flexor, and two muscles on the medial side, adductor and the first palmar interossei. Remember, interossei are also meant to adduct the digits. So both of them will provide this action of adduction. So you should remember in a long time that these two will be on the medial side, adductor pollicis and first palmar interossei. And the other two, that's abductor and flexor pollicis brevis, they will be attached onto the lateral side. What remains is opponens pollicis. Now, opponens is the muscle which has an evolutionary influence. If you think about the difference between the hand of an ape and the hand of humans, we humans have this thumb rotated medially, right? And that's an evolutionary criteria of Homo sapiens sapiens. So thumb always have this, if you let your hand set at ease, you will find that thumb does not comes in alignment with the rest of the digits. It rather is twisted medially. It is rolled up towards the index finger. And that's the reason, because opponens pollicis, this muscle, is not reaching to the phalanx, rather is attached to the lateral side of the first metacarpal. Because of the tonicity of this muscle, opponens muscle, which also is providing the contour to the thenar eminence, so it maintains the medially rotated position of the first metacarpal. So remember that opponens pollicis does not reaches to the phalanx. While longus, you should always remember that longus is the term when it reaches to the terminal phalanx. So flexor pollicis longus will insert onto the base of the palmar surface of the terminal phalanx. Similarly, on the dorsal side, it will be extensor pollicis longus, which will be inserted onto the base of the terminal phalanx of the thumb on the dorsal surface, while extensor pollicis brevis will be inserted onto the base of the proximal phalange of the thumb. Another muscle, if they ask, which inserts onto the first metacarpal, and that is abductor pollicis longus. This is the muscle which is participating in boundaries of the anatomical listen of box, the anterior boundary along with the extensor pollicis brevis. So now let's summarize here. We are talking is about the insertion only. We are not talking about any origin of any muscles here. So remember, insertions on the first metacarpal, there will be opponens pollicis and abductor pollicis longus. Abductor is at the base of the first metacarpal on the lateral side, and opponens is along the shaft of the first metacarpal on the lateral side. Then talking about the long muscles, the longus, flexor pollicis longus, extensor pollicis longus on the terminal phalanx, palmar and dorsal surface. The remaining muscles, they will all be attached onto the proximal phalanx. On the lateral edge of the base, it's abductor pollicis brevis, flexor pollicis brevis. On the medial edge of the base, there will be adductor pollicis and first palmar intrusii. On the dorsal aspect of the base will be extensor pollicis brevis. So I hope it will be easy for you to remember now. 2 muscles on the terminal phalanx, 5 muscles on the proximal phalanx, and 2 muscles on the first metacarpal. These 2 are important. So answer to the question number 6 will be opponens pollicis.